Before diving deep into the episode, I just want to say a massive thank you to you guys. So, we're all about building a space about wellness and personal growth. So we really want to bring the best conversation on Wellsome podcast. And in order to do that, I really ask you to support our journey, hit the thumbs up, just share the episode if you really think that it can resonate with your friends. And don't forget to subscribe and hit the bell to keep up with us. Hello everyone, welcome back to Wellsome, a podcast where wellness meets self-development. I am Viky, and in each episode I'm gonna dive deep into real conversations about health and personal growth. So in today's episode, I have the pleasure to have a conversation with Dr. Shefali.
Hi.
Hi.
Thanks for having me.
I'm so happy you're here.
I'm so happy to be here.
I love it. And guys, Dr. Shefali, she's an integrative medical doctor, and she's been in Dubai since forever. We were chatting about
it.
it.
Yeah, a long time. I actually came here in 1983.
Wow.
Yeah,
wow.
Before you were born, way before you were
wow.
born. Yeah.
And just because the journey that he has into medicine and then functional medicine, it's so deep and so insightful, I could not resist to just squeeze her brain and just have it on the podcast and just dive deep into this functional medicine that is still something unexplored for most of people, and also dive deep into a topic that it's very, 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 I don't want to say trendy, but it's very important. It gained relevance, especially nowadays, which is menopause and women's health. So, doctor, thank you so much for being here.
Thank you for having me.
So, first thing first, as always, I ask my guests about their stories and how did they start their journey. How did you start your journey in medicine and then eventually in functional medicine?
I mean, my parents were both doctors.
Okay.
So I was introduced to medicine very, very early. I mean, I remember as a child, my dad was a surgeon, and when I used to play with dolls, I remember putting my dolls, hooking them up to like IVs and coloring their water.
No, that's so funny.
Coloring their water red and putting like bandages around their head, because my father did a lot of trauma, because there was a lot of road traffic accidents in that time. Oh. And when he would be called, if I was with him, we had no one to drop us to. So he would take me into like hospital. So I saw a lot when I was young. And I think medicine was like one of the biggest things that we were introduced to. And I think as Indian parents, their encouragement was very much like, well, they're all going to be doctors.
Yeah.
And so that kind of just happened quite naturally, really, is getting into medical school. And then in my final year at medical school, I lost my dad. My dad was in a coma for like 18 days. And, you know, being the relative, I think, of somebody who's in hospital really changes your mindset. It changed my mindset on many things. It also changed my mindset is that, you know, doctors are not always going to be able to save people's lives. We had all, you know, it was very busy. We had so many relatives, so many friends, my dad's well-wishers, all religions. Everybody was praying, but no one was able to save him. And that really changed my mindset. And being the relative, how I was talked to, really changed how I wanted to talk to patients and giving them time, you know. And then when I qualified, I realized that I wanted to spend so much more time with the relatives. They weren't just bed numbers, whereas when we used to go on a ward round, like we'd know, okay, bed number 3, bed number 4. And there was always a priority. What can we do with this person? Yeah. If we can't do much with them, then it was just like hanging about. But this person, we can do something. So there's more energy into that because time is so limited. Yeah. And I struggled with that. I struggled with not knowing relatives' names or things. So I ended up always spending more time. And then I was going to be a surgeon, but I needed to take time off. Yeah. And so I trained. My other love is sport. I'm very into sport. I've always been very active. So then I decided I was going to do sports medicine. So I did my master's in sports medicine.
Here in Dubai?
No, in London. I was in London the entire time. So Manchester for my undergrad, and then postgrad I was in London. Yeah. So I did my master's and I worked at the Commonwealth Games. I did many things really in sports medicine. But I always thought that what's the worst I can tell this patient? Yeah. Not that they're going to die, but maybe they're not going to be able to play their sport, or, you know, we're going to have to like rehab for a bit, you know. And I felt the weight of it relative to the weight of what I was seeing in hospital was just, I was able to deal with that emotionally a lot better. And when I went into, sports medicine and working with athletes, I was introduced to my husband, and he basically introduced me to functional medicine through his mentor. And then through that, it was like looking at sort of root cause of disease. It became interesting for me. I did a lot of work in body composition. So where do you store your body fat, and how can you manipulate your body fat for athletes by changing physiology? So looking at sort of like, where are the blocks, the roadblocks, whether it's absorption, whether it's hormonal, abundance, calories. When you start manipulating all those things, you start to look at, root causes of things, and you realize the healthier your systems are on the inside, the better you look on the outside, And then I retrained in, nutritional therapy is the degree that I did in the UK, which was built on functional medicine from the US.
Yeah.
So it had the same sort of, and that's how I ended up starting my journey in integrative medical.
Which is
medicine.
actually like a journey itself. Like
Yeah,
it
it is
didn't
a
even
journey.
start.
No.
And before you went through such an amazing journey. And I think it was kind of like, from what you told me, like kind of like meant to be, maybe, that you were introduced into this world of functional medicine.
I really truly think that I've always been very curious as an individual. And I think when my father had his cardiac arrest, on that day, he had seen a cardiologist and he was cleared, and there was no why. There was never a why that was answered. And as a family member, I was like, well, why? Did I do this? Did I do that? Could I have done this? Could I have done that? And I realized that most relatives and most patients want to understand.
Yeah.
And I think
prevent eventually.
And prevent. And I also think that when you understand, you're able to make changes.
Yeah.
And a lot of times I feel like in conventional medicine, you don't have time, and functional medicine allows you to have to listen and connect with a patient, which is what I needed to do, for my own self.
Yeah, I love that. Well, I am familiar with functional medicine, but I'm not sure if our listeners are familiar. So I ask you the question, what is exactly functional medicine, and what's the difference between functional medicine and, I would say, maybe general medicine?
Yeah, conventional medicine.
So
functional medicine is really looking at the root cause. So a lot of times when things are acute, you'll go into a conventional, you want to get rid of the symptoms because they're acute, or we're already in the disease process. So we need to help that patient in that disease process. But no one's looking at the background, like, why did it happen? So I truly believe the little thises are tolerable. So it's like this, and then it's that. And then that, everyone's like, doctor, now fix me.
Yeah.
But it's not the that. The that you might be able to help with the symptoms. It's all the little thises that in functional medicine, when you take this extended long history, you want to look at where could things have started to go wrong. But because they were tolerated, we let them go. Or because somebody else is facing them or has them, or we're all bloated, or blah, 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 whatever it is, you almost think that, it's kind of normal. It's not a big deal. And normally, to go to a doctor is a big deal for most people.
Yeah.
It's scary. It's morbid a lot of the times. It's in a clinical situation. People are uncomfortable.
Yeah.
So if it's tolerable, they're like, I'm not sick. But no one's saying, I'm not well. Maybe I'm not well, right? I'm not ill, but I'm also not well. And no one's chasing to be well. Yeah. They just don't want to be sick. And often that's an extended length of history period. Yeah. And that's what functional medicine is supposed to be rooted at doing, is looking at the story before the disease happens, or looking at the story as to why the disease has happened. Absolutely. And helping that. So it's not just symptom control. Yeah. We want to look at why.
Yeah. It's so interesting that you said that people are chasing, I don't want to be sick, instead of, I want to maintain my health and be well.
I know. And I think that's something that has become more my purpose.
Yeah.
So I see patients in clinic, but on the other days I educate. And I try to raise awareness on the proactive healthcare, because even for me emotionally, to see patients every single day when you're taking extended histories of people also who have only seen conventional, and they maybe not have gotten the answers that they wanted. They come with a lot of heaviness. There's a lot of psychology. There's a lot of emotional, tension. That seeing that every day is hard for me to be a good mother when I go home, or a good wife. So half the time I also spend trying to educate people. And I want medicine to change. Can people find medicine fashionable, you being Italian, like fashionable as opposed to morbid and I don't want to go there and that's not where I want to be? Can they come in and be like, there's nothing wrong with me. How can I get better?
Yeah.
Is there something I could do to be better? That's what I want. And I think the more people that go and chase and be like, there's nothing actually wrong, but let's have a look at things and see, can I even be better? And if they're able to do that, I feel like the disease intensity and frequency might change.
Yeah.
But we're not doing that.
Yeah. First of all, I'm amazed from what you said, because I truly believe that the wellness industry in general and the health industry in general is changing a lot.
Yeah.
Because before we were focused on symptoms rather than prevention, and rather than let's look at it, even though you still don't have symptoms. Because I don't know if you agree with me, and I want to hear your opinion about this. The moment you have the symptoms, I don't want to say it's already too late, but this started way before.
Definitely. So every disease, there's a story behind the diagnosis. And that story is where little things have gone off kilter and ended up in the disease process.
Yeah.
And as much as diseases feel like they start overnight, they don't.
Yeah.
You know, it is very rare for a disease to start overnight. And I think that's where, if people are more educated, thinking about all the other things that they could do, how should one live, or how could you improve things? What is important to do every day? If we had that knowledge and we developed our non-negotiables early, as opposed to being so reactive.
Yeah.
Right? Suddenly we're at university, we've gained those 10 kilos because everyone gains 10 kilos, okay, at university. Well, they shouldn't. Everyone's done all-nighters because that's how they study. Well, maybe they shouldn't. If we start to tell people and kids early as to why sleep's important, as opposed to you'll just be tired.
Yeah.
But if we actually telling kids and educating them and saying, well, when you don't sleep, these are the things you're missing.
Yeah.
And if we're able to teach them, then when they go to university, they may not be so quick to be let's just do an all-nighter because everyone's doing it.
Yeah.
You know, peer pressure is a really big thing.
Yeah.
And that's how I think generation over generation, we end up with the same diseases, because we traditionally do exactly the same thing that we were taught, and no one is kind of breaking cycles.
Yeah.
And I think the proactive healthcare industry is about trying to teach people to be proactive and not reactive anymore. Let's not wait for it to happen.
Yeah.
Let's prevent it from happening.
Yeah.
You know, and let's learn from all the diseases that did happen, as opposed to letting them just happen all over again.
Of course. So before the podcast, actually, we were talking a little bit about, cultures, etc. And you said something that it blew my mind, that you said that sometimes we just repeat habits that culturally, and we saw maybe our parents do something, or eat specific things, or just move in a specific way, or having specific diseases, and somehow just because they're our role models, we learn from them. We learn from them.
We learn from them, and we learn generation on generation. The same culture passes through the generation.
Yeah.
But that culture could lead to a certain disease that now we think is genetic, but it's not on our genes. It's in the culture that leads to this disease.
That's what I want you to say, exactly.
Yeah. So I always say this in clinic. Your genetics loads the gun, but your environment pulls the trigger, right? So even if things were on your genes, it's the same environment that predisposes you to the same disease that you learn generation on generation. And that's where breaking generational sort of traditions becomes important. This must have been years ago, where my husband told me this story, and he said he read this on the internet, and he said, a young boy goes to his mom and says, "Mom, whenever we eat turkey, why do you cut the turkey into 2 halves and put it in the oven?" She said, "I don't know, ask your grandmother." So he goes, "Oh, granny, why do you cut the, chicken into 2 halves and put it in the oven?" She goes, "I don't know, ask your great grandmother." He goes, "Okay, great." It happened to be alive, I guess, at that time. Why do we do it? He goes, "Oh, we didn't have a really big oven at that time. And so we had to cut half the chicken to fit it into my small oven, because that was the size of our oven."
Yeah.
Now that at that time was a small oven. And then the granddaughter saw that and said, "We obviously must need to cut the chicken for some reason into halves." even though we have a bigger oven, and that goes on generation. But nobody asked that question. Why did we do that back then?
Yeah.
You know, why do we actually need to? We didn't need to. We just couldn't fit in.
Yeah.
But that becomes a habit throughout the culture.
Yeah, automatic repetition without even asking.
Not even
why.
asking.
Yeah.
And I think that's also very similar. This is what we do. This is how we eat. Well, how you eat leads to this. Maybe we need to change how we eat.
Yeah.
You know, if you do what you've always done, you're going to get what you've always gotten. And that's not rocket science.
Absolutely. Absolutely. And how do you think we can actually, and if we can actually blend in like functional medicine with medicine, with general medicine? How did you call it before?
Integrative medicine.
Integrative medicine with functional medicine.
Well, I believe integrative medicine is a combination of the two.
Yeah.
So when someone is acute, they need to see a conventional doctor. So I often refer, I don't believe that we need to treat everything.
Yeah.
So it's not natural medicine. That's not what I'm doing. But I question how quickly you might have an antibiotic, because I know antibiotics affect the microbiome.
Yeah.
So I need to know. But if you have an infection and you require an antibiotic to get rid of that infection, you still need to do it.
Yeah.
Yeah. You don't need to we don't get props for making someone sicker because we gave it naturally. That's not my type of medicine. If someone's bleeding and they're in an acute phase and they need to have a steroid to stop this acute phase, we will do that. The patient's safety is the most important thing.
Yeah.
So in terms of blending, it's about, okay, let's get rid of the symptoms so that you're well and you're feeling better now because the symptoms affecting you now. But if we take that medicine away, if you haven't changed anything, why wouldn't it happen again?
Yeah.
And the functional medicine is changing the backstory.
Yeah.
I always tell people, if you want to change the ending of a storybook, if you change 2 pages, that ending doesn't make sense. You've got to change chapters. Yeah. And those chapters become your chapters in your sort of storybook of your disease.
Yeah.
And that's why you got to look at beyond just the immediate, because it hasn't started from immediate.
Yeah.
You know, so integration is about listening, knowing when it's acute, knowing who to call upon, you know, having your list of your specialties that
Yeah.
you trust, who believe in what you're doing, and being able to integrate it all together so that the person gets the best outcome. Because it's not about me keeping my patients to me.
Yeah.
It's about me being able to do right by my patient.
Yeah.
So that ultimately, if ever they needed something, they'll come back and ask me why, because I knew I introduced them to all the right people when they needed it.
Of course.
And I think that's also a difference that I feel, you know, medicine needs to be. It's really hard. Everyone is hustling.
Yeah.
Life is expensive. You know, we have targets to make, even as doctors, a lot of times in conventional, there are targets. And I think when we start mixing business in medicine and service industry, it becomes difficult. So we need to always keep eyes on the prize. And the prize actually is the patient's health.
Yes.
Not the prize of
Not
what
the money.
we're, you know, money. Money will come because you're good.
Yeah.
Right? But I think it still needs the protagonist in this entire story is the patient.
Yeah, absolutely.
You know?
Absolutely. And also, first of all, I thank you so much for sharing this, because I think that spreading the message that conventional medicine and functional medicine can go hand in hand, it's key, especially in the near future.
Yeah, you know, quite a few years ago, I was asked by someone, would I be interested in adding a differential diagnosis that was a functional medicine aspect? So if a medical textbook, before you go into sort of invasive things, or in a functional medicine perspective, what else could we be thinking that we could do in line with treatment? And I think that's the future of medicine. Can we have both side by side? And it is happening.
Yes, it is happening.
Yeah, it is happening.
And we're very happy about it.
Very happy.
Even me as a health coach, specialized in gut health, sometimes people ask me, but are you replacing a doctor, or what are you doing? We're not replacing anything. We're co-creating.
Correct. I'm 100%.
Yes.
I like that word, co-creating. I'm going to use that.
Yeah, so I'm happy that actually you point out this message, because it's a co-creation at the end.
100%.
Yes.
And I think that, you can be many of us,
Yeah.
you know, to help a single person. There's so
Yes.
many times that I'll refer to somebody, or a health coach will refer to me, but I will also say, go back to your health coach. It's not about like taking you away.
Of course.
They've also done something really good, and maybe
Of
you need that
course.
extra help with them, and that's okay.
Yes.
Whatever is best by you.
Absolutely. And Doctor, you have so much knowledge, and the reason why I wanted to invite Dr. Shefali in the on the podcast is because I feel that your journey is so complete and you can talk about so many aspects about medicine. But in today's podcast, I really want to focus on one specific topic that I feel nowadays, and to be honest, especially in Dubai now, is rising, which is the topic of menopause. So a lot of women are, I don't want to say struggling, but I think a lot of women are dealing with this transitional, like, you know, moment called menopause. And I think,
I mean, in the perimenopause, to be honest, they're struggling.
Yes, yes. And I feel that before there were not as much, you know, knowledge and talks and conversations about it in the past. I'm glad that now it's rising. But I want to hear your take about menopause, how to navigate into it and how to take it in, like, from an, you know, functional medicine perspective.
So I think, you know, you just said something that, you know, are we raising more of an awareness? I don't think, we're not just been struggling now. I think we've forever struggled with the symptoms of perimenopause going into menopause. But I think now women are coming out to say, look, do I have to feel like that? And what can I do to not feel like that? And there's no taboo talking about the fact that we're transitioning into the menopause. In fact, there is an andropause for men as well.
Yeah.
When their, you know, levels of testosterone drop, things change for them too.
Of course.
In menopause, I feel like, you know, so the definition of menopause typically is when you haven't had a period for 12 months. So that officially means that you're in menopause. But prior to that, the perimenopause can last up to 10 years. Seriously.
I swear I didn't know about it.
Yeah, you can have symptoms running into your menopause that are deemed perimenopause. So there are already changes in your cycle that are happening over time that you might have symptoms, and they just become more and more sort of intense over a 10-year period. And that's very important to know, because in the menstrual aspect, say forever how long, say one gets their period between, you know, 11, 13, you know, and then go into like menopause mid-50s, say. Those 40 years and 10 years of perimenopause, those 30 years of being sort of fertile in your prime also have so many challenges. Some people don't have much, you know, menstrual symptoms, and some people do. And nobody thinks that that's important. And in functional medicine, I believe the prevention of your symptoms starts early. Just like with everything.
Do you personally suffer from?
I have used to suffer horribly. So another reason why I went into functional medicine so easy is that I've had digestive symptoms from as long as I remember. I must have been 3 when I was admitted to hospital for a curate appendectomy. And I was waiting nil by mouth because they were going to do surgery, and I was so hungry, and I remember telling the doctor, it doesn't hurt, give me that toast. I remember that so clearly. I don't have that many memories. And then when I was 20, I almost had a surgery too, and I'd been admitted to hospital several times, and through that my periods used to be extremely painful. So painful that I think really up until the age of like leaving for university, there was at least one night during, you know, my periods that I would knock on my mom's door and get her to come and say, it's hurting, and I'd cry and I would move and I'd have a medicine and she'd sit with me, she'd rub my back for a few hours until I used to go to sleep because they were so painful. But also I was constipated, but in medicine, I mean, I'm sharing so much on this, but like in medicine, they teach you what is normal for you. If you don't go every day, but how often do you go? Is that normal for you? That's okay. No, it's not okay. You know, your transit time should be between 12 and 24 hours. So you are constipated. Let's figure that out early. Why are we waiting for like 30 years to feel what it's like to not be constipated?
Yeah.
And I think someone had introduced me to someone in London who said, go and see this woman. And it was about weight or whatever. This was well before going into functional medicine. And she talked to me about allergenic foods. And I came off those foods and I wasn't bloated. I pooped every day. And I was like, wow, I've lost a bit of weight. I'm less watery. I was like, there's something about this.
Yeah.
You know, and then when you feel good, you don't want to not feel good again.
Of
you
course.
So there was something in your food and things like that. So I was like, okay, that's really interesting. And I felt very energetic, but it taught me about learning about other foods, because when you're reliant on dairy and you're reliant on gluten, you feel like when you have to take them out, you have to take it out of, it's almost like, well, what do I eat? But when you look at food sensitivity testing and you take away gluten and dairy, you're like, okay, that's about 20 foods you can't eat. But there are 240 foods you can. Focus on what you can, not what you cannot. And that's learning to open your variety of nutrition that we don't do now in today's world.
Yeah.
And so for me, I used to have extremely bad pain. And in the moment, you know, I went in on my own journey, it's been really good. But obviously I'm nearing 50 now, so I'm 48. So I'm probably perimenopausal. And I say probably because other than maybe potentially my cycle being maybe a day shorter at times, and I don't really have many symptoms.
Yeah.
But I think it's because I do everything else.
Yeah.
You know, but I think people who don't make changes and they have bad period symptoms are more likely to get worse off symptoms when the fluctuation becomes so vast and the ratio progesterone to estrogen becomes such a big problem.
Yeah.
You know, so when I look at in functional medicine, it's about asking questions and learning about your history. And I'll still go through your entire journey and try to optimize all the other things to see if I can lessen the blow, which is the menopause. So if I fix this and I fix this and the intensity of this and you have your nutrition, your symptoms may be actually very tolerable.
Yeah, absolutely.
You know, and
so
that's
it's not avoiding the moment. It just try to sustain it in a good way.
Yeah, some people can go through into menopause with no symptoms.
Yeah.
In fact, my mom, if I ask her, she says, I might have sweated a few nights, but honestly, she had no symptoms.
Yeah.
You know, but that's not for everyone. Some people do struggle much earlier as well.
Of course.
And I think
what are the main symptoms?
So obviously there are hot flashes, change in your period. You can get much worsened menstrual. So recently I've been having patients with a lot more menstrual migraines. You know, odor, like changing in how you're smelling things that aren't actually there.
No.
Hair loss, craving more sugar, gaining obviously weight in that midsection sort of area. Sleep, mood. You know, just feeling like you're just not yourself.
Yeah.
Libido, loss of, you know, being dry, it being painful. It can, and then losing all your collagen and feeling like you're, you know, I guess, you know, more wrinkly and having more wrinkles. And then obviously then it becomes the bone health and the osteoporosis. And then, you know, all the things of aging, changing your posture, becoming shorter, you know, stature. And that's how we age, you know. But if you look at all those things and you improve things earlier, why do we have those 80-year-olds that are running their marathons?
Yeah.
Why do we have it's not only genetics, it's also about choices that they made and when they decided to make them.
Yeah.
You know, theoretically, I always see people who are like, if you're older, you're like, oh, don't do this. Or, you know, we take away their independence.
Yeah.
And I think if you take someone's independence and their purpose away, why won't they age?
Absolutely.
You know?
You said something about the specific symptoms that is gaining weight. And I know that a lot of women that are in this perimenopause, they gain a lot of weight. For example, my mom, she gained a lot of weight. And she was suffering because she didn't really know how to manage it and because she didn't know, do I need to starve? Do I need to go to the gym? She was very like, I don't want to say frustrated, but she felt a bit stuck because she didn't know what to do.
And it feels like it's come out of nowhere.
Yeah.
And you don't recognize yourself anymore and you become desperate.
Yes.
And I think a lot of different things happen. Obviously, the change in your hormonal status happens. So, you know, lack of, your estrogen drops. First of all, it goes wild, and then it drops. Progesterone also drops. When sleep gets affected, and they don't have as many good night's sleep, there are other hormones that are present when you sleep. Leptin, ghrelin, which affect your satiety, affect your feeling hungry.
Yeah.
And they go the wrong way, so you're more hungry. You're not feeling full as much. So you're not enjoying your food. Your choices of food becomes a problem.
Yeah.
When insulin gets affected and you become more insulin resistant, the same amount of insulin doesn't work anymore.
Yeah.
And so you're not utilizing the sugars, so they have to be stored, and they're stored as fat.
Yeah.
When you lose your muscle mass, because when you get older, you have sarcopenia and your muscles decrease. When you decrease your muscles, you become more insulin resistant. And then that becomes a problem.
Yeah.
So insulin takes a massive hit. It becomes stressful because the brain's like, we're not making as many follicles. Come on, like we need to. So adrenaline and then your cortisol starts piling on, let alone all the stress that at that age we're going through. Our kids have left. They're now, you're trying to find your purpose.
Yeah.
You're worried about your children. You have more stress in life. And we're not managing that anymore because we're no longer number one as parents, and we're always like focusing on our children. We don't manage our stress. A lot of them go into an element of adrenal dysfunction already. And then this timing of, going into perimenopause and menopause worsens. So the accumulation of it gets affected. Thyroid then gets affected, which is your metabolic hormone. Yeah. So everything's a lot harder to work. You're just not as metabolically active.
Yeah.
So you have to create your base early.
Yeah.
You got to get the muscle mass on early.
Yeah.
You got to know your nutrition early. You got to get your stress management in there early, so that when things you start to already know change, and where do I need to implement what.
Yeah. By the way, I think you said something very interesting, which is the moment where maybe like a woman has kids that maybe they have been growing up, and then maybe they leave for university, or for maybe they want to live abroad.
That empty nest.
The emptiness, exactly. And the rebalance also, what is your purpose? I think this is a topic that it's not really explored.
No, and I don't think even people,
but it's relevant,
and it's so important.
Yeah.
If you don't have purpose, I think you age faster.
Yeah.
Because you don't have a motivation to build anything or to do any. Your self-worth changes. That adds stress.
Yeah.
That gives emptiness. It gives loneliness.
Yeah.
Loneliness and isolation is a form of torture.
Yeah.
Right? So if you're busy and you're all this kind of stuff, you're doing stuff around your kids and you never meet your friends, and then suddenly your kids go, and then you've lost all your relationships with your friends, and your work didn't work because you gave everything to your children, and now they're not there.
Yeah.
Rebuilding you takes a lot longer.
Yeah.
And I think at that time in your life, so many other things are happening that we just focus on hormones. It's not just hormones.
Yeah.
It's everything else that's associated.
Yeah.
How can I improve my sleep, when it starts to look at it? So there are lots of nutrients, but if you had your sleep as a non-negotiable early, you'll know what to do to try and manipulate it further when you go into those stages.
Yeah.
And those stages will come far later.
Yeah.
A person that's on MAG and really, wearing the Whoop or a wearable and knows how they're sleeping and stuff like that, when it comes to perimenopause or menopause, they might have slight changes. It won't be drastic.
Yeah.
Someone who doesn't care about their sleep, thinks that it's fine to sleep on 4 hours forever, they can steal their sleep and do other things. At that time, there's no recovery.
Yeah.
Yeah. So it is about, there's still an element of proactive an aspect to it.
Yeah.
And
if you, doctor, if you need to design a perfect protocol based on functional medicine for women who are entering in this very delicate, also beautiful in another way.
I mean,
phase. Because it's just a phase, just a season of life.
It's just another side of another stage.
Exactly.
Of your life.
What would you recommend in order for this perimenopause and menopause to be as smooth as possible?
I always think, don't wait for it to come. Why are we waiting till you're in perimenopause to seek help? can we be that person to go and say, nothing's wrong with me, how can I make myself better?
Yeah.
If we are that person who goes into your health journey head on, and I want to learn as much, I want to look after me because I am number one. For all the things that you love and you do everything, it be your kids, be it your job, be it money, be whatever. If anything happens to you, you failed all of them.
Yeah.
So you are number one. So number one, tell yourself you're number one.
Yeah.
Go proactively in and try and optimize your health early.
Yeah.
Do regular checks, regular bloods. Not when you're symptomatic, when you're not symptomatic, and look at what your levels look like.
Yeah.
Go and I would even say meet like a functional health coach or a functional doctor, look into your gut health, because a lot of times hormonal imbalances stem from digestive health.
Thank you for that. Thank you for that.
Right? And I think that we often neglect it because so many people are bloated. Yeah. So many people are constipated. That doesn't have to be you.
It's not normal.
It's not normal.
We don't want to normalize this, of course.
No, not at all. And I think that's where I feel like people need to look into sort of how they're eating, what their microbiome's doing. Yeah. So your microbiome is really responsible for detoxifying. Yeah. So you can only detoxify truly in your stool, in your urine, and in your skin. And in order for you to detoxify well, all those elements need to be working well. Yeah. And the first sort of system that basically gets affected is your digestive health from birth. Because the moment, if you are a C-section baby, your microbiome is already different than if you were to come out the birth canal. But often we're not the ones to decide that if you've had a tough pregnancy. So for me, I had twins, I had a C-section. I know all of this, but I knew I was going to have a C-section. So I was proactive in trying to have probiotics when I fed the children. But one of my girls went into ICU. And when she was in ICU, my milk didn't come in so fast. Did she have formula straight away? Yeah. Did that change her gut microbiome? Immediately. So those are the uncontrollables. I couldn't help that. What could I do? I could give her probiotics. I could watch her nutrition. If I felt she was colicky, maybe I would take her away from dairy early. It's how I implemented and changed the diet where I could. Yeah. If she gets an infection and needed to be on antibiotics, I gave her probiotics. Yeah. I did some gut health stuff. I gave her cod liver oil. And I think this is where we can be proactive by looking at your gut health. So decreasing your risk for having a bad menopausal symptoms or going through the change and it being very hard. Yeah. I think looking into gut health is very important. Looking at your nutrients. Are you a good methylator? Are you not a good methylator? All your cofactors. Do I detoxify in the most efficient way to allow for detoxification of my hormones to happen when they are too high relative to others? And then there are lots of herbs and things like that can help normalize estrogen progesterone ratios during that time. And precursor to these hormones are your stress hormones. Yeah. So managing your stress early or looking for help to support you during that time, I end up supporting the adrenal function too. Yeah. Because by then your adrenals might be a little bit tired. Can I support the adrenals? Can I supply you with other nutrients that you're deficient in? Because you are not what you eat. You are what you absorb. True. Right? So nutrients can also, fill up some of the holes of fatigue, and those nutrients can then lessen the blow of how menopause is going to feel like. And it's by looking at where can I lessen the blow so the intensity and severity of these symptoms of change are manageable. Yeah. We're all going to go through it. Another thing is to talk to people. Yeah. You're not alone. Yeah. Speak to other women, you find your circle, your trust or whatever have you. Look into, life is very yang. So find the yin in your life. Where is the calm in my storm? And emphasize that and put energy into that. Yeah. And I think the more we're able to do that, the more you feel like, whoa, I'm proactive. Yes. Yeah, I'm powerful. Empower yourself as opposed to feel like, it's desperate or I can't do anything. Yeah. When you start empowering, women feel empowered, and I think that's where this new knowledge of everyone talking about it and being open is like when they're sitting next to somebody who's also going through it or has been through it, you just don't feel alone.
Yeah.
You know, and I think that's also very important when it comes to the change. You know, I think it's far worse when you feel like you're dealing with it by yourself.
Absolutely.
You know,
Absolutely.
So I wouldn't say functional medicine in menopause or perimenopause. I would just say looking at root cause of everything. The label means nothing. So whether it's autoimmunity, whether it's menopause, whether it's whatever, it's just looking at root cause. It's looking at where in my day-to-day things have started to go wrong that leads to the dis-ease that I'm currently feeling. Label it what you want. The more you improve the little thises that happened before the that will improve. And if it doesn't improve and we need to take medication because it's too late, that's also fine.
Yeah.
But what we don't want is the that to become a bigger that.
Yeah.
Or another that.
Yeah.
You know?
Absolutely.
Is can we stop the process?
Absolutely.
You know? And so I think that's where integrative medicine, I feel like, is becoming the future.
Yeah.
Especially with social media.
Yeah.
Right? People are more and more aware because of social media that it exists. So they're delaying a little bit going to see doctors.
Yeah.
Because they're like, do I trust this 100%? It doesn't make sense. And that's why I feel like as doctors on the other side, it is our job to be able to communicate what we want the patient to do.
Yeah.
And if they don't understand, sometimes you have patients who are not going to understand regardless. They want you to tell them what they want to hear. That's different. But most of the time, if you're able to explain it well enough and you've made a good connection, they'll comply.
True.
You know, and then you'll have the result that you want.
True.
You know, so
True.
I do feel like it's about listening. It's about the patient talking. It's about, you know, not waiting too long for symptoms. Normalizing things just because it's common.
Yeah.
Stress is common. Stress is not normal.
Yeah.
Right? You don't have to wear it as a badge of honor.
Yeah. Just because it's common doesn't mean that you need to accept it.
Accept it, and that's how we all are.
Yeah.
You know, no.
True.
Like, it's okay. What can I do to help myself early?
True.
You know? And I think that's where I think the process of everything that is negative when it comes to health will change.
Yeah, absolutely. Very, very interesting. And thank you so much for sharing
you.
all of this. Actually, I really loved our conversation because we started from your journey and then we dove deep into the functional medicine aspect, and then we gave a perspective on menopause that probably people wouldn't, and women especially, wouldn't really taken care of, because for example, for me, I'm not in that stage yet, but still I would have thought, okay, like even though I come from integrative nutrition as well, I wouldn't necessarily think that this is something you can prevent.
Right? Yeah.
Years ago, I'm gonna be honest.
Yeah.
So I'm glad that you shared this with us, with listeners, and to women. And please, if someone has questions or want us to dive deep in, like more into the topic, please comment, because I'm sure you will be more than happy to.
You can talk. I love to talk. So
exactly.
Well.
And Doctor, thank you so much for being with us.
Thank you for having me.
And guys, I'll see you on the next episode. And thank you so much for listening and watching. Good.
Oh.